Welcome to the week on quantitative analysis. Last week we covered what you do in situations, how to appraise, and how to think about understanding research questions from a qualitative perspective. This week we're going to really focus on the quantitative version of that. How do we actually conduct quantitative analysis? What are the components of a qualitative analysis? And the most important thing we're going to cover this week, and one of the most difficult concepts we're going to cover in this class, is the ability to understand and interpret what a p-value is, because the difference between proper understanding and improper understanding of a p-value is an important outcome of this class. And for most of the articles you're going to appraise, there will be some answer to the research question, whether it's effectiveness or risk or proportion of a population, that's going to involve using a p-value or probability value to assess whether the finding is relevant and meaningful for you. So a proper understanding of the p-value is probably the most important outcome of this lecture this week, and we're going to continue with it because it's so important next week. While last week we dived into the qualitative component, most of this semester we've been focused on quantitative issues. So whether it's quantitative issues around sampling or around measurement, we've focused on the important issues for assessing the validity and the reliability of evidence from a quantitative perspective. What we haven't really done is dived into the notion of what quantitative analysis is, and that's what we're going to cover this week. But first I want to review a few things that we've talked about at multiple points in the semester, but are very important to understanding what we're going to do this week. The first one is this diagram that we have used several times in this class to identify the key variable components of any analysis that we're going to have from a quantitative perspective. So we have our dependent variable, we have our independent variable, and then we have a set of other variables that we're either controlling or adjusting for, or our extraneous variables that we just want to deal with. This model also implies a causal relationship, that there is something that happens, the independent variable, whether it's poverty or an intervention like assertive community treatment or cognitive behavioral therapy, that then causes something else to happen. That something else is an outcome, whether it's reduced hospitalization in the case of assertive community treatment or lower rates of depression in the case of cognitive behavioral therapy. We think that there's some causal relationship between the introduction or the absence of presence of the independent variable and the dependent variable. And so this causal model that we have is the foundation of our statistical analyses. And in many of the statistical procedures we have, we're going to be testing this relationship. Now, as to whether we can infer causal relationships depends on a lot of things, but suffice it to say, this is the sort of the foundation element that most of the quantitative research is striving to address. The other thing that I think is important to revisit here are these notions of levels of measurement of variables. We talked about that a couple of weeks ago when we identified nominal variables, variables that name things, ordinal variables, variables that have an order to them, like good, fair, poor, but don't have numerical values in between, and then interval and ratio measurements, which have different attributes, but are not only have an order to them, but have some number between as you move between categories. So the difference between age 1 and age 2 is a single year, and so that number means something. It's not just a set of ordered relationships. It's order with some meaning. This week we're going to borrow, and next week we're going to keep using these concepts, but we're going to apply statistical procedures to these levels of measurement. So for example, a nominal variable or an ordinal variable will often be treated as a binary variable, a 0-1 variable, a yes-no variable, an on-off variable, something like that. Numerically, we generally designate that as a 0 for no and a 1 for yes. So nominal variables, we will say, is somebody male or are they not male, which generally means they're female? Are they African American? Yes or no. Are they white? Yes or no. Are they Asian? Yes or no. Are they Hispanic? Yes or no. So we break up these named categories into a series of yes/no questions, and those are what we call dichotomous or binary kind of variables. So interval or ratio measures we designate either as counts, Some things are better organized as a count variable, and sometimes we call them continuous variables. So a interval measure we can treat either as continuous or count, and ratio measures are properly designated as continuous. And what we do with each of these variables, whether it's binary or dichotomous, count, or continuous, is going to determine a set of distributional assumptions or different statistical procedures that we use to understand what's going on in a population using those kinds of variables. So the type of level of measurement is going to determine what statistical procedure we use. While all of you have taken statistics before as a prerequisite for getting into this course, and I'm sure that you guys all remember every little nuance, detail, and formula you learned from that course, since people tend to really love their statistics courses. This is a review for most of you. But there are two basic kinds of statistics that we're going to talk about here. One is descriptive statistics, where you are just using these numbers to describe your sample. So what is the average amount of depression that I have in my sample? What's the average age of my sample? How many people identify as white? How many people identify as African American? How many people identify as transgendered in my sample? So those are descriptive statistics where we're describing the sample. The second category of statistics are inferential statistics, and these are what we're more often interested in. This is where we make an inference based on the sample and apply it to a population. So this is when we talked about sampling, we spent a lot of time about being able to use this sample to represent a much larger population. As a pollster, I can interview 1,000 or 900 people, but based on that 1,000 or 900 people, make a statement about the hundreds of millions of people that are potentially going to vote in the next election. So you can use a small group of people, a sample, to draw inferences about the behavior of a population. And there's a variety of statistical procedures that we use to draw those inferential understandings of behaviors of populations based upon what happens in a sample. So we're going to start off by talking about descriptive statistics, what a variety of those statistics are, the major statistics, and then we'll talk about p-values the rest of this week. Next week, which is an inferential procedure. Next week, we're going to be diving really into inferential statistics and spending a lot of time there talking about different inferential statistics procedures, demystifying what they are, and giving you a set of tools to critically appraise the evidence presented in the study results sections that will often use these kinds of inferential statistic procedures.